explain self-recognition and tolerance to own tissues. So the primary task of the immune system is to distinguish the enemy from its own cells. Cells have special unique proteins on the surface called antigens, which are used for identification. Thanks to them, the immune system identifies bacteria, fungi, viruses, pollutants, and other pathogens as foreign and tries to destroy them. Additionally, it can recognize pathogen and distinguish from good body cells. Antibodies are highly specific because one antibody can only recognize a specific antigen. Additionally, the specificity of the antibodies means that one type of them can only destroy the foreign body to which it fits, like a key in a lock. The immune system can recognize, remember, and distinguish its own self from others. Unfortunately, the skills of the immune system in some situations, instead of helping, can harm if the only way to save people's health or life is by requiring a transplant. Adaptation of the transplant depends on the comparability of antigens on the surface of the recipient and donor cells. The greater the comparability, the greater the chances of accepting the transplant. Therefore, um, autograft of skin or transplants between identical twins are usually very successful as they have the same antigens. It is also worth remembering that the more related the donor and recipients are, the greater the likelihood of transplant acceptance. Now let's talk about the diseases. Rheumatoid arthritis is a chronic autoimmune disease of the connective tissue. The cause of this disease is the malfunctioning of the patient's immune system. The elements of the immune system identify the body's own tissue as foreign and launch an attack against them using various types of immune mechanism. It is the most common inflammatory disease of the joint. It is estimated that it affects around 1% of the population, with women over 50 years of age usually struggling with it. Although the exact causes of the RA are not known, high attention is paid to the genetics and environmental factors such as smoking or stress. The most common symptoms include pain, stiffness of the joint, tendency to pressure, as well as swelling, which can cause limited mobility. It is crucial to diagnose and treat RA as soon as possible in order to minimize and prevent the spread of the disease. Multiple sclerosis is another disease. It's a progressive disease of the nervous system that can lead to disability. About 30 people per 100,000 suffer from multiple sclerosis. It causes changes with the central nervous system, the brain, and the spinal cord. Moreover, the absence or significant damage to the nerve fiber sheath result in abnormal or difficult conduction of nerve impulses. The most common symptom is sensory disturbance and sensation in the limbs. Other symptoms include tingling, numbness, and pricking as multiple sclerosis progress. The patient might experience paresis, eye movement disorders, as well as balance problem and dizziness, and inability to control sphincters. And that's right. So let's talk about specific immunity. It's a type of immunity that is acquired through our life. However, most of its mechanisms began to develop at the time of birth. Specific immunity can be further divided into active and passive. Active immunity is produced after the contact with an antigen as a result of an illness, and therefore is called natural, or thanks to vaccination, where it's called artificial. On the other hand, specific passive immunity is associated with the transfer of immune antibodies to the child with the mother's milk, which is called natural, or by administering immune serum, which is artificial. This type of immunity, although crucial for the function of the immune system, depends on the innate immunity because prior contact with the antigen is required for its activation. However, it is specific to the antigen and works faster and more precisely in the event of subsequent contact with it. In addition, it is also important feature is the ability to create immunological memory. Immune response. Now, active immunity involves the production of antibodies and memory cells as a result of infection after the administration of a vaccine. The vaccine contains weakened or killed pathogen. The antigen from the vaccine introduced into the body stimulates the cells of the immune system to produce specific antibodies. Immune memory cells are also formed, which provide a long-term protective effect of vaccination. If there is a contact with a pathogenic microorganism, immune memory cells lead to production of specific antibodies that prevent the development of the disease. In general, the principle of the operation of vaccine is to imitate a natural infection. After the vaccine is administered, the same natural defense mechanism will work as in the case of contact with the pathogen. Vaccine antigens trigger the production of antibodies and other elements of the immune system. Thanks to this, when an immunized person comes into contact with a given pathogen, the immune system will be prepared to resist the attack of a dangerous pathogen and faster and stronger. Upon recontact with the antigen, immune memory cell lead to a secondary immune response, which is characterized by a rapid production of specific antibodies responsible for preventing the development of the disease. Therefore, this type of immunity is the safer rather than the cause of natural disease. Vaccination. Vaccination mobilize the immune system, but they're also too weak to cause disease. They are given in advance before a person comes into contact with the germs. After the vaccine, when a pathogen appears, the body already has defense tool and prevents the development of the disease or fights very quickly. Although some vaccinations are mandatory, other are only recommended. Herd immunity is a situation where enough of a given population has become immune to infection either through a vaccination or disease or indirectly protect the unvaccinated. As research shows, a large percentage of vaccinated people reduce the risk of contracting a given disease by unvaccinated people. This percentage varies obviously depending on the infectious disease. In order to gain herd immunity for measles, which is obviously highly contagious, a very high vaccination rate is needed, around 94-95%. Herd immunity not only protects society against mass infection, but also protects the people who for various reasons cannot be vaccinated. Additionally, reaching the point of herd immunity allows the pandemic to slowly die out. On the other hand, some people simply do not want to be vaccinated for numerous reasons, such as religion or ethical issues. Therefore, some of the other methods were introduced, such as protective isolation, which refers to practices and behaviors used for protecting the most vulnerable people from contracting an infection. For many years, a vaccination calendar has been supplemented and modified in accordance with current medical knowledge to ensure the uptake is made not only easily available but also convenient. The NHS vaccination guides help the parent to understand the vaccine offered, as well as explain in detail how they work and when to have them. The effectiveness and safety on immunization programs are monitored by observing the expected and actual effect of such a program on disease transmission patterns in the community. Factors affecting vaccine uptake. So a lot of controversies and false information have arisen around vaccination in recent years. The growing anti-vaccination movement misleads people into thinking that vaccination are associated with high risk and harmfulness. Additionally, some people believe that vaccination are linked to autism. Therefore, many studies have been conducted to verify the potential link between some vaccination and autism. And so far, no such link has been found. Moreover, although some vaccines can have adverse side effects, most of them are mild, like swelling, redness, and usually go away within a few days. Some people also argue that vaccines do not protect 100% against the disease. However, it is worth remembering that they significantly reduce the risk. Studies state that the effectiveness of children's vaccine is high, approximately 85 to 98%. Benefit of vaccination. There are many benefits associated with vaccination. They protect against deadly and health-threatening diseases. Lack of them would be associated with an acute cause of the infection and is dangerous complication. Obtaining immunity in this way is not only effective but also much safer than natural contact with the specific pathogen. Thanks to them, no one has been suffering from smallpox for many years. Unfortunately, some vaccinations do not provide 100% immunity, and a vaccinated person might contract the disease against which they were vaccinated. However, often the infection is milder and the risk of complication is lower. Vaccination benefits not only the vaccinated but also those around them, especially the most vulnerable and newborns. Vaccination therefore brings obvious health benefits but also help to save money by reducing the overall cost of treatment. It also contributed to the protection of employees and reduce infection in companies and therefore reducing absence from work due to illness. Thank you for listening.